Your nose is one of the most prominent features on your face. Hopefully, you're happy with it. But for a number of people out there, a break, a bump, or even the length of your nose may make you hate your appearance enough to consider surgery. Well, how about a 15-minute procedure that can change all of that? A nose job without surgery. Dr. Cameron Rokhsar is here to tell us all about it. Welcome, doctor. Great to see you again.
Good morning, Tanya. How are you?
I'm well. Tell us a little bit about this 15-minute procedure.
Well, you know, traditionally everybody thinks of a nose job as being surgical, and that's what it's always been. You know, you cut and you break a bone and so on and so forth. But there's a whole new idea, and that's recontouring the nose. So we can actually achieve a different nose through injections of filler substances to recontour the nose. And so by actually adding things and recontouring it, the nose can look better and improved.
So walk me through a typical procedure. What would that look like?
So, you know, a typical patient would be, let's say, somebody who has a bump on their nose, or who has a droopy tip, or patients with dents in their nose or sideways deviations. There are also patients who've had prior nose jobs or rhinoplasties before and it hasn't come out exactly the way they want it. Lastly, there's that segment of the population who have flat bridges, and that's a very common problem in Asians and African Americans where they want to create a bridge. There's also a segment of the population that may not be ready for a surgical nose job, and they want to just try things out just to see if they, you know, they would like a different shape of the nose, you know. And so the patient would come in to the office, we would apply a numbing cream for about half an hour, and then through precise injections of a filler substance by the name of Radiesse, we can actually correct some of these problems and irregularities.
And how long does this last? How long do the effects of this procedure last?
With the use of the filler Radiesse, the results can last up to a year.
Okay. So it is something that you would want to have touch-ups done down the line.
It is temporary. Currently, we don't have a filler available that's longer lasting.
Okay. But you get up from the chair after the procedure, you feel no pain, you go back to work?
Yeah. I mean, this is truly something you can really do on your lunch break,
right.
And that's what's nice about it. I mean, you come in, you do the procedure, and you get on with your life. And so, you know, in New York City, where everybody is busy and, you know, we have lots of professionals, people want to have a quick fix. It's really a very nice procedure for somebody.
And how much would the typical procedure cost?
You know, a typical rhinoplasty, depending on what you're getting done, can cost anywhere from $10,000 to $15,000. Right. And so obviously cost is a factor for that. A non-surgical rhinoplasty is really a fraction of that. I mean, a typical case would be something on the order of $1,000.
Right. So doctor, tell us a little bit more about this filler. How long has it been around and what are its other uses?
The filler Radiesse has been FDA approved since 2003. It has multiple FDA approvals, including for medical reasons and cosmetic reasons. For cosmetic reasons, it's FDA approved for injecting into the face for laugh lines, as well as injecting for hollowness for something called HIV lipodystrophy, where HIV positive patients get hollowness in their cheeks through use of HIV meds. We can use Radiesse pretty much anywhere on the face. We use it on the nose to recontour the nose. I use it on the chin to create a more pronounced or, you know, augmented chin. You can also use it for creating you know, nicer cheekbones or, you know, laugh lines, nasolabial folds, or anywhere basically where you want to add volume to the face.
And for all of these different uses, it does wear off in about a year.
It does,
right?
And you know, in different anatomic regions in the face, it has a various durability.
Right,
you know, so in certain areas it may last longer, and in certain areas it may last shorter, and that has to do with probably blood flow in the area.
All right, so we have one of your patients here who just had this procedure done yesterday. Molly, thank you so much for joining us.
Thank you for having me.
You look beautiful.
Oh, thank you.
How do you feel?
I feel great.
And you just had this done yesterday. Tell us, what was the sensation when you were having the procedure done?
To be honest with you, all I felt was Dr. Rokhsar's, you know, fingers on my nose. I didn't feel a pinch of a needle or anything like that.
No pain whatsoever?
I promise you, no pain whatsoever, truly.
Now, your nose looks beautiful. What was it that you were trying to correct?
I had a big bump right in the middle, and you can still see sort of the remainder of it, but it just always caught my reflection. I didn't like the side profile of my face, and so I wanted to sort of camouflage that a little bit.
And are you happy with the results?
I am. I'm very happy.
Looks great.
Thank
it looks
you.
great. Now, are there any candidates or any patients who you would not recommend this procedure
Yeah,
for?
I mean, this is definitely not meant to replace a nose job. There are candidates that really have to have a surgical rhinoplasty. For instance, if somebody has an issue with the shape of the nostril, or the fact that, if the nostril is too big, that's something that really needs to be done surgically.
Right, right. This is more to correct bumps or tips.
If, to correct a bump, to make the bump smaller, to raise a tip, to fix post-surgical rhinoplasty problems, to create a bridge, on the nose for Asians and African Americans, and for people who just want to test drive kind of a new nose.
Absolutely. Check it out first before they commit to the surgery.
Exactly.
Now, what is the long-term future of this procedure? Are they going to develop an injection that may last longer than a year?
I think, with the advent of new fillers, that possibility definitely exists. Currently, I don't think we have a safe filler that's longer lasting. Radius happens to be one of the longer lasting fillers, and it happens to be a very nice filler for this procedure because it's it's made up of calcium hydroxyapatite, which is calcium is very similar to what we have in our bone and our teeth, so it's very complementary for a place like the nose to actually inject it. We also use this substance, for example, for non-surgical chin augmentation as well. That sometimes goes together with, goes nicely with the nose.
Are there any side effects? Is there any swelling after the procedure?
Typically, patients can get a little bit of swelling maybe for a day or two. Bruising can happen, although it's extremely rare. But even if you get a bruise, you can easily camouflage it with a little bit of makeup.
Right.
But it's not the type of procedure that it's really you're meant to take time off.
Right. And Molly, once the numbing cream wore off, did you feel any sensation? Nothing.
I really didn't.
Wow, that's amazing. So it sounds like it's completely pain-free, which is a big bonus for a lot of people.
Exactly.
All right. Thank you so much, Dr. Rokhsar. And Molly, thank you so much for sharing your story with us.